I am Oyelere Deborah Ayobode. I'm a registered nurse and a NSC holder. The topic now is medical surgical nursing, and the main topic is respiratory tract. You can see the diagram of the respiratory tract. We have the external nostrils, which is mainly for air intake, the nasal chamber, filters here, the trachea and mucus. We have the pharynx, common passage for air and food, larynx, sandbox, housing vocal cords, epiglottis, flap preventing food entering into the windpipe, trachea, long tube in the mid-thoracic cavity, bronchi, trachea divides into left and right bronchi, bronchioles, smaller channels branching from bronchi, alveoli, balloon-like structures of bronchioles end, lung, sac-like organ covered by pleura. Now the pathophysiology. Inhalation and nasal cavity. Air is inhaled through the nostrils. In the nasal cavity, fine hair follicles cleanse the air. Blood vessels in the nasal cavity warm the air. Part of air through the respiratory tract. Air moves from the nasal cavity to the pharynx, then to the larynx. From the larynx, air travels into the trachea. Trachea and bronchi lined with ciliated epithelial cells and globular cells. Globular cells secrete mucus to moisten air and trap dust of pathogens. Motor cilia beats upward motion to move mucus and particles to the buccal cavity. Foreign particles are either coughed out or swallowed. Air movement to the lungs. Air travels from the trachea to the bronchus. It then moves into the smaller bronchioles. Finally, air reaches the alveoli, where gas exchange occurs. Respiratory system function. Respiratory system functions. The functions of human respiratory system are as follows: inhalation and exhalation. Breathing involves air entering through the nose, passing the pharynx, larynx, trachea and reaching the lungs, then exiting the same way. Lung volume and pressure changes drive these processes. Gas exchange. Bloodstream and body tissues. Oxygen diffuses from the lungs into the bloodstream, binds to hemoglobin and reaches body tissues. Carbon dioxide moves from tissues to the lungs for exhalation. Gas exchange, lungs and bloodstream. Oxygen and carbon dioxide exchange occurs in alveoli. Oxygen enters blood, binds to hemoglobin, while carbon dioxide moves to alveoli and is exhaled. Vocal cord vibration. Muscles in the larynx move the arytenoid cartilages, pushing the vocal cords together. Air passing through them during exhalation makes them vibrate, producing sound. Olfaction, that's smelling. When inhaling, chemicals in the air activate receptors on the cilia in the nasal cavities, sending signals to the olfactory bulbs. Respiration in organisms. Respiration is vital for all living organisms. While humans breathe, unicellular organisms rely on diffusion of gas exchange. Breathing versus respiration. Breathing, physical process of inhaling oxygen and exhaling carbon dioxide, while respiration is a chemical process where oxygen breaks down glucose to produce energy for cellular functions. Respiratory disorders. Disorders affecting the lungs and airways are asthma, emphysema, lung cancer, and tuberculosis. Impact the respiratory system. We have the lungs, the nose, wide pipe, the throat and voice box. Many can be prevented with proactive health measures. Symptoms of respiratory disorder. Respiratory disorder impacts the lungs and airway, causing symptoms that affect breathing and overall health. They can be acute or chronic, infectious or non-infectious. Reason: high-pitched whistling sound caused by narrowed airways, common in asthma and chronic obstructive pulmonary disease. Chest tightness, discomfort or pain varying in intensity depending on the condition. Sputum production, thick, colored mucus seen in bronchitis, pneumonia and cystic fibrosis. Fatigue, reduces oxygen intake, leading to extreme tiredness. And tachypnea, rapid breathing, often associated with acute infection. Symptoms of respiratory disorder include cyanosis, bluish tints in lips, fingertips indicating low blood oxygen, chronic cough, persistent cough common in chronic bronchitis, nasal congestion, stuffy runny nose from infections like cold or flu, infection susceptibility, frequent bronchitis or pneumonia in vulnerable individuals, clubbing, branded solely fingers toes in chronic respiratory conditions. Causes of respiratory disorders. Identifying causes is essential for prevention, early diagnosis and effective treatment. Smoking, major preventive cause of respiratory issues. Pollutants, indoor and outdoor pollutants like particulate matter and ozone irritating airways. Allergens, triggers like pollen, pet dander and dust mites can lead to asthma. Occupational hazards, exposed to substances like asbestos, silica and coal dust can lead to conditions such as pneumoconiosis, occupational asthma and work-related chronic obstructive pulmonary disease. Infections, viral and bacterial infections like flu, pneumonia and TB (tuberculosis) cause lung and airway infection. Genetic factors, some disorders are hereditary. Prevention of respiratory disorders. Preventive measures are crucial in reducing the incidence and severity of respiratory disorders, promoting better lung health and improving overall well-being. Number one, avoid smoking. Quit smoking and stay away from second-hand smoking. Second-hand smoking simply means when somebody is smoking and you are around that area, that means you are inhaling what the person is smoking out. Improve indoor air quality. Ventilate spaces. Use air purifiers and minimize allergens. Regular exercise strengthens respiratory muscles and enhances lung function. Manage allergies. Use medication and avoid allergens. Healthy lifestyle promotes better lung function and reduce risk. Diagnosis of respiratory disorders. Medical history. Providers gather details of symptoms, duration, triggers, past conditions, family history and lifestyle factors e.g. smoking, cannabis, pollutant exposure. Then physical examination assesses overall health with a focus on the respiratory system. Lung function test. Spirometry evaluates lung capacity and airflow to identify conditions like asthma and chronic obstructive pulmonary disease. Imaging studies, chest X-rays and CT scan detect abnormalities like tumors and infections. Blood test, assess oxygen and carbon dioxide level, white blood cell counts and specific markers for respiratory disorders. when there is increase in white blood cell damage and infection. Symptom analysis analyzes markers for pathogens and indicators of diseases in respiratory infections or chronic conditions. Bronchoscopy diagnoses lung cancer, infections, and inflammatory diseases. Treatment options for respiratory disorders: we have medications which include bronchodilators, corticosteroids, antibiotics for bacterial infections, and antiviral infection drugs for viral infection. Oxygen therapy: supplemental oxygen for severe respiratory issues. Allergens immunotherapy: allergy shots to reduce sensitivity to allergens. Pulmonary respiration rehabilitation: breathing techniques and exercises to improve capacity. Then surgery: surgical interventions for structural issues or tumor removal. In conclusion, respiratory disorders present significant challenges to individuals and their loved ones, as they can profoundly impact one's quality of life and overall well-being. This comprehensive exploration of symptoms, causes, prevention and treatment underscores the importance of understanding and addressing these conditions with empathy and compassion. Thank you.